Hello, South Florida and beyond, and welcome again to the How to Stay Healthy show, where we bring you the top doctors in the area to talk about what's the latest in health surgical treatments. We got Dr. Neil Galindez joining us. He's a cardiothoracic surgeon. He'll be on the air in just a minute. But before that, I just want to tell you a little bit about All County Healthcare Incorporated, our sponsor here on the How to Stay Healthy show. So, living a longer and healthier life, sponsored by All County Healthcare, a Medicare certified home health agency. I'm David, your host for this evening. You can listen to us every Tuesday from 6 to 7 p.m. right here on 95.3 FM and 1470 AM. And now Fridays, which you're here with us right now, 5:30 to 6 p.m. We're also live streaming on All County Healthcare's Facebook page. You can get more information or see a show later on if you want to kind of jot something down and go back later on. You can go to allcountyhealthcare.com as well. And if you have any healthcare questions or any questions about home health care or Medicare certified home health care agencies, you can call Maddie at 1-888-717-7170. She'll be happy to answer your healthcare questions. And thank you for joining us. So tonight we're going to talk a lot about the heart, which is always an important topic, and especially in South Florida, as we have a lot of baby boomers, and with baby boomers is something I didn't know about until a few years ago, atrial fibrillation. So that's something that I've heard patients describe as a flutter in the heart, and we're going to have the doctor on in a second to tell us a little bit more. So with that said, we're going to have Dr. Neil Galindez. He's a cardiothoracic surgeon with Tenet Florida Physician Services. You might remember Dr. Galindez in the past. He was on staff at Palm Beach Gardens Medical Center, and he was on staff at both hospitals, actually, Palm Beach Gardens Medical Center, Florida Medical Center, and Delray Medical Center, I believe. But Dr. Galindez, I'm going to put it in your own words. Welcome to the program. How are you?
Hello, David. How are you? Thank you for inviting me.
Thank you for coming on the show. So we were just talking a little bit. You were actually in Palm Beach Gardens where you started with Tenet, but then you branched out, I think, to Delray Medical Center, and now you've moved your practice right near us right here. We're on the line of Palm Beach and Broward County. You're over in Broward County at Florida Medical Center is the hospital you're on staff at, and then you have an office in Lauderdale Lakes right there on the campus, right?
That's right. I'm part of the group, right? Tenet Florida Physician Services. Our group is made up of 4 cardiac surgeons, and we cover Palm Beach Gardens Medical Center, the Rain, Florida Medical Center, St. Mary's Medical Center too. We work with the trauma surgeons very closely there.
Okay, so you're on staff at all 4 of those hospitals.
Right. That's right.
So again, that's Palm Beach Gardens Medical Center, where we knew you from the past, St. Mary's Medical Center in West Palm Beach, Delray Medical Center, which is the level 1 trauma center in Palm Beach County. So is St. Mary's, actually.
That's right.
They're both the 2 level 1s. And then Florida Medical Center campus in North Shore, which I've known before my foray into healthcare, was always a heart hospital. That was always one of the top heart hospitals in the area. So you're on staff at all 4. Wow, that's amazing. I don't know if I've had a lot of doctors on the program or on staff at 4 hospitals.
As I said, we are a group of 4 cardiac surgeons, and we cover all of them. So we distribute ourselves into the centers, but we do work on all of them. Yes.
Nice. And I wanted to have you on the program for a little while now, because I know you have a lot of new treatments for atrial fibrillation. And I got to be honest with you, about 5 years ago, I never even knew what atrial fibrillation was. We're going to say it as short, AFib, because that's the acronym. But I interviewed a patient who had a flutter in her chest. She said it felt like there was a bird in her chest. Have you ever heard that as a symptom of AFib?
So let's tell your audience what atrial fibrillation is. First of all, your heart. There's the reason why your heart beats regularly is because there are a group of cells, very specialized heart cells, cardiac cells, in the muscle of the heart that make impulses, electrical impulses that will travel through normal pathways throughout the muscle of the heart from the upper chambers of the heart to the lower chambers of the heart. When they go through the upper chambers of the heart, which are the atria, the atria contract to send that blood from the top chambers of the heart to the bottom, which is the ventricles.
Okay.
Then when the electrical impulse travels down through the normal pathway to the ventricles, then the ventricles contract to eject or send all that blood through the valves into either the lungs to get oxygenated or to the rest of the body, right? That's
Okay.
how the heart works, and that's one heart contraction. Now, atrial fibrillation comes when there is multiple places on the atria, on the top chambers of the heart, generating all those abnormal impulses at the same time, erratically, and this makes the atria contract in a very irregular way. And those impulses, once in a while, pass down to the bottom chambers of the heart, the ventricles. So there's gonna there's really no contraction as it was before when it was very regular. Now it's going to be very irregular because some of those abnormal impulses from the top chambers of the heart pass abnormally to the bottom chambers of the heart. Now,
Amazing.
what the problem is that when you have this situation, the atria, which we have a left-sided and a right-sided atria, most of the problem we know that comes from the left side. Now, just imagine before, when in a normal heart, the atria contract so we can eject that blood from the top to the bottom of the heart, right?
Okay.
Now with atrial fibrillation and having a lot of abnormal impulses, electrical impulses, different parts of the atrium start contracting at the same time and irregularly, okay? So the efficacy or efficiency of that part of the heart ejecting blood to the bottom part of the heart is lost. What's going to happen is with time, the chambers start enlarging, right? There's going to be more pressure in there. It's going to start enlarging, and then with the enlargement of the heart, the enlargement of that muscle, something happens which we called fibrosis. Fibrosis is another word for scar tissue. Kind of like when you stretch the skin, right, and you lose weight again.
I've seen that from lifting weights.
You get
Okay, that's
stretch
what that
marks.
is. Wow.
That's scar tissue on the skin.
So that happens to the heart too.
As heart surgeons, when we do open heart surgery, we can actually see the hearts, and we can actually palpate and touch the hearts, and we can see the scar tissue that forms in the atria because of the enlargement of that cavity. So when you have a lot of scar tissue, which is called fibrosis, more abnormal impulses are generated, more abnormality of the transmission of those impulses results from this scar tissue. So the problem starts probably with persons having very short episodes of atrial fibrillation that come and go, maybe lasting a few minutes. It goes to hours, it goes to days, and with time, there's more enlargement, more scar tissue, and it becomes a more chronic, more permanent problem until the patient is on atrial fibrillation all the time.
Wow, unbelievable. That is an awesome explanation. And if you're driving around South Florida, you got to check the video of this broadcast after. It's like Dr. Galindez had a heart in his hand as he was explaining it in studio. Is amazing. So you can check us out on amp2.tv on YouTube after the program over the next few days if you miss anything today. Or if you're driving around and it's safe to pull over, call in 1-888-565-1470. You can maybe get a question or two to Dr. Galindez on air. I wanted to ask you, what would happen if that atrial fibrillation went on and it was untreated? So obviously it becomes a quality of life issue first because maybe getting that flutter and that abnormality. But what if it's not treated? Like if someone has and they don't go see their primary care cardiologist, can it lead to stroke or other?
That's right. Quality of life is very important. And some of the symptoms that patients have with atrial fibrillation is this flutter fluttering of the chest that you just mentioned, right? And that happens because, as I explained before, the electrical impulses are coming very irregularly, and that makes the heart sometimes beat very, very, very fast. So that's when the patients feel palpitations. That's how it's called, the fluttering of the chest, palpitations. They feel like a little lightheaded, they feel tired, they feel short of breath. Okay, some of them could actually lose consciousness just because of how fast the heart is beating.
Actually faint?
Actually faint.
Oh,
because
no.
if your heart starts beating very, very fast, there's not enough time for the ventricles to fill up the way they're supposed to be for the next contraction to eject all that blood to your brain and to the rest of the body. So if it's beating too fast, there's no good feeling of the heart, and there's not enough blood going into the brain and to the rest of the body. So some patients can have these symptoms. So it is very life limiting. These events, when they happen, patients could feel really, really bad, and that's what brings them to the hospital. Now, your question was, what happens if this gets untreated? If it just goes untreated? Unfortunately, about 40% of patients with atrial fibrillation do not feel anything. And that's very dangerous because they're walking without medical attention, without seeking any medical treatment, right? Because they don't know they have atrial fibrillation. Yet, we know that patients with atrial fibrillation are at about at least 5 times more likely to have a stroke. Now, why is this? When the atrium are contracting or fibrillating, they're not contracting actually, they're fibrillating. That's why it's called atrial fibrillation. And there's another word for quivering. Okay, instead of contracting the way it's supposed to be, they're just quivering, they're just shaking. So the blood does not flow the normal way from the top chambers to the lower chambers. So what's going to happen is, on the left side, on the left atrium, there's a little pouch called the left atrial appendage, kind of your appendix from the ascending colon, like when you have appendicitis, they took the well, kind of like that. There is a little pouch on the left side of the upper chamber called the left atrial appendage. And that appendage, because it's part of the atrium, is on atrial fibrillation as well, there's not enough, the circulation of blood is not regular. So it gets stagnant. And what happens when blood gets stagnant anywhere, either outside the body or inside the body? It creates clots, right? Yeah. So all the proteins and all the platelets, and they're going to start working together to form clots. When a clot forms, a blood clot, one small clot can just get out of that little appendage, go into the regular circulation, go up to the brain, and cause a stroke. So a person with atrial fibrillation has a 5-time risk more than anybody else, more than somebody without atrial fibrillation, of having a stroke. And that's why patients with atrial fibrillation need to be on anticoagulation, meaning blood thinning medication, either warfarin or any of the newer agents that we use for that. But that's the reason why they need to thin their blood.
Unbelievable information. Dr. Galindez, hold that thought. We're going to talk about cardiothoracic surgery and electrophysiology treatment combined in one for atrial fibrillation, or AFib, on the How to Stay Healthy show. We'll be right back. How to stay healthy. It's a question asked by many people and answered by few. On How to Stay Healthy with David DePino, I'm going to bring you the latest in health news by interviewing top doctors from South Florida and around the world. Tune in on Fridays at 5:30 p.m. right here on WWNN Radio 95.3 FM and 1470 AM, the Health and Wealth Network, to hear the latest health treatments and my curveball question of the hobbies and passions in life doctors pursue when not providing medicine.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
And now back to How to Stay Healthy, your weekly doctor's interview and prescription to better health. Hello, South Florida, and welcome back to the How to Stay Healthy show. We're here with Dr. Neil Galindez. He's a cardiothoracic surgeon with an office in Palm Beach Gardens right here in northern Palm Beach County. And right around the corner, we're in Boca right now, but right around the corner in Lauderdale Lakes, which is Fort Lauderdale area, he's got an office on staff on the campus of Florida Medical Center, a campus in North Shore. The best way to get in touch with Dr. Galindez for you, their office is 954-714-0686, or even looked it up. You have your own URL. It's drneilgalindez.com, Neil Galindez, GALINDZ.com. That's awesome. That's where I got the information. I want to talk, we were talking right before the break. So I'm thinking cardiothoracic surgeon. I'm thinking you're the surgeon who opens up the chest or goes through the back area to the lungs, thoracic area. But now you're doing things minimally invasive for atrial fibrillation. You're actually working with a cardiac electrophysiologist to do this convergent procedure. Can you tell us a little bit how that works to treat this atrial fibrillation, I guess, from the outside and the inside? You guys meet kind of in the middle?
Yes. So there's many options to treat atrial fibrillation. It all depends. Not all atrial fibrillation is the same. So the patients have to seek for medical attention with a cardiologist and an electrophysiologist. This is a cardiologist that specializes on electrical abnormalities of the heart. Once they are diagnosed with atrial fibrillation, they need to know what kind of atrial fibrillation they have. There's patients that have very short episodes of atrial fibrillation that are well controlled with medication, and medication is a great option for them, okay? Now, there's patients that need a little more than that, either because their symptoms are more severe or because the atrial fibrillation is more chronic. And for these patients, maybe some of them can be candidates for something called a catheter ablation. And the electrophysiologist goes into one of the groins through the artery with a special catheter. They drive that catheter all the way up to the heart from the inside of the heart. With special cables and catheters, they can actually do a 3D reconstruction of the left atrium of the heart, put it on a computer, and see where the atrial fibrillation impulses are coming from. Okay, it's amazing to see this. So when you get this little catheter, you can actually ablate, which is another word for burn. You can burn or buzz these abnormal electrical impulses and see how you can suppress all that abnormal activity.
That's scar tissue.
The scar tissue.
Yeah, that's what we were talking about.
And all the circuits and all the firing, the abnormal firing in the atrium. Yeah. Well, that's done by the electrophysiologist. Okay. Now there's a certain population of patients that have the more chronic type of atrial fibrillation. We call it persistent or long-standing persistent. These are patients that have been with atrial fibrillation for weeks, months, even 2 years, right? The changes in the heart, they're more severe. Their atrium are already enlarged. They have a lot of scar tissue. They have a lot of electrical impulses. So catheter ablation is not as good for this kind of patients. Mm-hmm. For these kinds of patients, that's when we start thinking about a hybrid approach. And that's when we combine the specialties of electrophysiology and cardiac surgery to get a better result when we ablate the heart. The cardiac surgeon ablates the heart from the outside, and the electrophysiologist, with a more traditional catheter ablation, goes from the inside and ablates the rest of the areas that we haven't done. Now, you mentioned the convergent procedure. This is a novel approach to atrial fibrillation, where the cardiac surgeon, with minimally invasive techniques, goes through a small incision just below where the ribs meet, right in front where they meet on the right above the abdomen and below the sternum, and we can access, with a very small incision, about 3 centimeters incision, we can access the sac around the heart. We can open that sac, and with a special camera and a special tube, a cannula, we can actually visualize the back side of the heart. I said before that probably most of the abnormal impulses are coming from the left side of the upper chamber, the left atrium. So I can, as a surgeon, I have access to the back wall of that atrium where probably 90 to 95% of the abnormal activity happens. And with a special catheter, I can go from the outside of the heart and start ablating all that area to suppress all the abnormal activity. After that, and when the patient is still under anesthesia, then the electrophysiologist comes in with a more traditional catheter ablation. They put a catheter through the groin, as I mentioned before. They go into the heart. They do the 3D mapping of the atrium, and they can see what's already quiet. What the areas that I was able to ablate, and the areas that still need a touch-up. So with their catheter, now they can close those little gaps to suppress all the electrical activity, and then get the patient, shock them back into the normal rhythm. And patients, we know that patients tend to stay in the normal rhythm, and it's more, the ablation is because a more complete ablation. Now, the convergent procedure is not done just everywhere. Fortunately, we're part of an institution where we offer this procedure. We are so much that we are part of a nationwide clinical trial that sees the results of the convergent procedure versus just the catheter ablation for patients with the persistent atrial fibrillation or long-standing persistent atrial fibrillation. These are the patients with a chronic type of atrial fibrillation. And we are, let me see, there's probably 15 centers so far in the trial in the U.S., and we're one of them, only 2 in Florida here, and the only one in South Florida.
Palm Beach Gardens Medical Center?
Palm Beach Gardens Medical Center, that's right. And
Wow.
both the tenant institutions.
I just want to show this, doctor, for the viewers. So what you're looking at there, as the viewers, is Dr. Neil Galindez and Dr. Matthew Klein, who's the cardiac electrophysiologist you work with at Palm Beach Gardens Medical Center, and your team just finished your first sub-X case in the Converge clinical trial there at Palm Beach Gardens Medical Center. Looks like October 30th. So that's a trial, clinical trial, research trial, correct, that you're involved in as a surgeon?
That's correct. So that's a research trial. That was our first patient, second patient for the trial, our first patient for this approach where instead of going, before we used to go through the abdomen to get to the heart. Okay, now we just go just below the ribs to get directly to the heart. So that was the first case. That was the electrophysiologist at Palm Beach Gardens Medical Center, is Dr. Matt Klein. The other electrophysiologist that I work with, and we are a team, is Dr. David Weisman. So the 3 of us are part of the trial.
Oh, fantastic. That's good to know. You guys are on the latest edge of heart care there for atrial fibrillation. And I just want to ask you, I just thought of something. People are probably driving around and thinking, during that procedure, do you have to stop the heart, or is this no heart and lung machine needed, or is the heart still beating while you're doing this?
Right. This is a elective procedure. The heart will not get stopped. This is not
that's good to know.
Open heart surgery. The patient will not get connected to the heart and lung machine to arrest the heart and work. So the way it works is the patient gets seen by the electrophysiologist, by me, the surgeon. We have to talk about the case and make sure that this is the best option for the patient. If the patient is eligible for this procedure, then we give him a date. The patient gets there in the morning. I do my part of the procedure first, the minimal invasive access to the heart. I do my ablation, and then the electrophysiologist does their part of the procedure. It all depends on how much work we need to do, is how long the procedure is. And then the patient goes to the ICU that afternoon just for observation. And then the next day they should go to the regular floor under observation with the telemetry. And usually it takes about 2 to 3 days for them to get to home. It doesn't compare to an open heart procedure where, the patients stay there for about 5, 6, 7 days.
And patients, they don't wake up with an issue and say, I'm going to go over and see my cardiothoracic surgeon today. It doesn't work like that. They go to their primary care or their cardiologist and say, I've got a little thing going on in my chest, or the primary care, when they use the stethoscope to listen to us, that's what they're listening for, is a little tick or something in there?
That's right. You have to, when you go for your annual assessment, or you're suspicious because you feel palpitations, or you feel fatigue, or you feel a little lightheadedness, they need to do a complete workup for the heart, right? So that the physical assessment and an electrocardiogram. And if they see something that looks like atrial fibrillation, then that's when they channel those patients to the cardiologist or the electrophysiologist, and then we'll take it from there. They can call us at my office or any of the electrophysiologist's office, and we can channel those patients to the right place with the right person to get checked.
And Dr. Galindez's office is 954-714-0686. That's 954-714-0686. You can see him in Palm Beach Gardens or Lauderdale Lakes. We only have 1 minute, and I just want to make sure we say thank you to all the veterans out there of our armed forces. We all appreciate the freedoms that you fought for, men and women, across the U.S. and beyond. Thank you. And Dr. Galindez, thank you so much for taking the time. I know how busy your schedule is. You're a surgeon, and you made time to really explain to us about AFib. I really appreciate it.
Thank you. It was a pleasure, David.
And you're always welcome on the How to Stay Healthy show.
Thank you.
For a prescription to better health from the top doctors in the medical fields of cardiology, neurology, orthopedics, sports medicine, and primary care, join us each week on the How to Stay Healthy show.